Welcome back, my dear friends. And now let us move towards the next segment and the next most important segment in upper limb topic. So we are now moving towards the discussion of all the major nerves and the minor nerves, which we have seen in the brachial plexus, guys. So what I will do here, first of all, let me tell you the entire planning, like how we are going to approach this topic and how we are going to make it easy. Then later on, I'll tell you like how to discuss all the major nerves in the easiest manner possible. So first of all, look at this diagram here, guys. We have discussed the entire brachial plexus in detail. You can look on the screen here. We have discussed the entire brachial plexus in detail, and I hope all my students are like expert in this one. Now, there are so many branches that you're able to see in the brachial plexus over here. Now, out of that many branches, do one thing. From now onwards, from today onwards, what you have to do is divide all the branches of the brachial plexus into two categories. One is major branches, another one will be the minor branches. Now you might be like, what is this major branches and minor branches, sir? Remember, major branches will be those branches, those long branches, which will be going ahead and supplying to the muscles of your arm, forearm and hand. So those are the major branches. Minor branches will be supplying to only and only the muscles surrounding the shoulder region here, pectoral region. I mean to say like pectoralis major, pectoralis minor, teres major, teres minor, all those muscles, guys. Understanding? So that is the difference between the major nerves and the minor nerves. Fine. Now, once you understood the meaning here, like what is major, what is minor, out of all these branches, like which are the major branches and which are the minor branches? If you have observed my diagram properly, I have written like 5 branches in capital letters. Everything is like well planned. Okay. So 5 branches I have written here in capital letters, and those are the major branches, and remaining all are minor branches, guys. So let's see here. Number 1, musculocutaneous nerve. Number 2, the median nerve. Number 3, axillary nerve. Number 4, radial nerve. And number 5, the ulnar nerve. So these are 5 branches that we have written here in capital letter. Those are the major branches, and remaining all are minor branches. That makes the things easier for you. Understanding? And first of all, what we'll do is we'll try to discuss these major branches, then we'll go ahead with the minor branches later on. Okay. Now I'll give you one important golden rule, guys, that makes your life easier to tell the nerve supply to each and every muscle. Fine. Now, what is that golden rule? First, listen to me. Then later on we'll write down together. Now, arm, forearm, and the hand. In the arm, first of all the muscles of the arm are divided into 2 categories or 2 compartments: anterior compartment and the posterior compartment. In the forearm, the muscles are divided into 2 compartments. One is the anterior compartment, another one is the posterior compartment. And in the hand, there are no compartments, only simply the muscles of hand. And I have already discussed all these muscles in detail in our previous videos, so that it will be very much easier for us to discuss this major nerve, guys. Just follow my planning, guys. Just follow all the videos in the same sequence. Is it okay? I repeat once more here. Arm, anterior compartment and the posterior compartment. Forearm, anterior compartment and the posterior compartment. And in the hand, simply the muscles of hand here. Now, all the muscles in the anterior compartment of the arm, listen carefully, guys. All the muscles in the anterior compartment of the arm will be supplied by musculocutaneous nerve. All the muscles in the posterior compartment of the arm will be supplied by radial nerve. Similarly, all the muscles in the posterior compartment of forearm also will be supplied by radial nerve only. So, radial nerve is the one which will be supplying to the entire posterior compartment. Entire posterior compartment, guys. The anterior compartment of the forearm, all these muscles are supplied by 2 nerves. One is your ulnar nerve, another one is median nerve. Now, the same ulnar nerve will continue ahead, and the same median nerve will be continuing ahead, and they are the one which will be supplying to all the muscles of your hand. That makes our life simple. Understanding here? So here it is musculocutaneous, here it is radial, and again radial here, and here it is ulnar and median, and then muscles of hand, again it is ulnar and median, guys. Okay, so all these are the major nerves. Now let us just write down, make a note of this one. So we are going to first discuss about the major nerves. So in total, we are dividing all the nerves into major and minor. In total, there are 5 major nerves, guys. And these major nerves will be supplying to your compartments or the muscles of your arm and the forearm and hand. The muscles of your arm, forearm and the hand. Now in the arm, all the muscles are actually divided into 2 compartments. One will be the anterior compartment of the arm and another one will be the posterior compartment of the arm, guys. And as we have discussed just now, all the muscles in the anterior compartment of the arm will be supplied by musculocutaneous nerve. musculocutaneous nerve, guys. And the posterior compartment of the arm, all the muscles will be supplied by radial nerve. Wow. Next one. In the forearm, all the muscles are actually again divided into two compartments. One will be the anterior compartment and another one will be the posterior compartment, guys. And then all the muscles in the posterior compartment are supplied by which nerve only? They are supplied by radial nerve. Fine. And the muscles in anterior compartment of the forearm will be supplied by two nerves, that is your ulnar nerve and median nerve. Ulnar nerve and the median nerve. And as I told you, in the hand, no compartments at all, guys. Just you got to remember that all the muscles in the hand will be again supplied by your ulnar nerve and the median nerve. That's all. Easy. So such a small table here, but it makes a clear-cut idea in your mind. Okay, so if tomorrow someone asks you the question, biceps muscle will be supplied by musculocutaneous nerve. Similarly, triceps will be supplied by radial nerve. So in this manner, like flexors should be supplied by ulnar and median, and the extensors should be supplied by radial nerve. It makes sense now. Now, if you're observing properly here, totally we are having like how many major nerves, guys? Totally we are having 5 major nerves, but out of them we have just written only 4 of them. One more which is left out here is your axillary nerve. Now remember, axillary nerve will be supplying to only and only 2 muscles, guys. And just remember that 2 muscles forever. Number 1 will be your deltoid muscle, and number 2 will be the teres muscle. But the important thing is whether it is teres minor or major. I want you all to concentrate there. Most of the students will be making a mistake there only. So remember, it is teres minor. It is teres minor muscle. So axillary nerve will be supplying to 2 muscles. One is your deltoid muscle, another one will be the teres minor muscle, guys. That's all. So this is our golden rule here, and this will be helping you a lot when you will learn about all the 5 major nerves first of all, guys. Okay. So now out of all these 5 major nerves, first of all, let's get started with the musculocutaneous nerve. We are going to discuss all of them one by one. First, let's begin with the musculocutaneous nerve here, guys. So the first major nerve that we are going to discuss right now is musculocutaneous nerve. Now guys, make a habit here always, whenever you are learning about any nerve, first make a habit of writing the origin of the nerve, from where it is beginning, and then what it is supplying to. And of course, in the supply, we will be learning about the motor supply to the muscle and the sensory supply to the skin. Fine. So in any nerve, first of all, make a habit of writing the origin first. And origin, I don't even have to teach you right now. All my students are like expert. We have discussed in detail in brachial plexus. Musculocutaneous nerve will be originating from lateral cord of brachial plexus. Can you just recall the mnemonic in your mind? For the lateral cord, it is LML, and there M stands for musculocutaneous nerve, guys. M for musculocutaneous nerve. Then what is the root value, guys? All the branches which are originating from the lateral cord, the root value will be C5, C6 and C7. So therefore, its root value is C5, C6 and C7, guys. Now, after writing the origin, the next thing to write down here is the supply. Musculocutaneous nerve will be supplying to what? It supplies to all the muscles present in the anterior compartment of arm. Just now we have seen this in our golden rule. Okay. So musculocutaneous nerve will be supplying to all the muscles which are present in the anterior compartment of the arm. Now, if you people have gone through the previous video where I have discussed about the muscles of your arm, forearm and the hand, now you'll understand the complete purpose of that. Now you don't even have to mug up here. What are the muscles present in the anterior compartment of the arm? You have got your BBC muscles, coracobrachialis, the biceps and the brachialis. So just write it here and finish it off, guys. So therefore, in the anterior compartment of the arm, number 1, you have got the coracobrachialis muscle, and number 2, you have got the biceps brachii muscle. There will be a biceps brachii muscle. And finally, number 3, there will be a brachialis muscle. Brachialis muscle. So these are the 3 muscles present in the anterior compartment of the arm. Understanding? So now, my dear doctors, if you just look at the screen here, if you are properly following all my videos from the very beginning, now I bet you, I challenge you, you don't even have to mug up anything here, guys. We already know the root value, we already know the origin, we already know the compartment, and also we already know about the muscles present in that compartment. So it is just like, combining everything at one place over here in the easy manner, and there is no tension at all here, no pressure here to mug up the things, guys. It makes sense now. Now, in the supply, we have just completed the supply to the muscles here, guys, anterior compartment of the arm, muscles there. So now let us see the sensory supply also. If you have actually concentrated on the name of the nerve, musculocutaneous nerve, musculo, it will be supplying to the muscle. Cutaneous, yes, it will also have the supply to the skin also, guys. There will be even a sensory supply also. Now, just look at me here. I'll tell you in an easy manner here. Musculocutaneous nerve is going to enter into the anterior compartment of the arm. Now, in the anterior compartment of the arm, it will be supplying to coracobrachialis, biceps brachii, and brachialis muscle. After supplying to these three muscles, it is not going to stop here. That musculocutaneous nerve will actually continue into the forearm, and it is the one which is continuing as lateral cutaneous nerve of the forearm. So it will be supplying to the skin on the lateral side of the forearm, guys. Okay, so from today onwards, remember it like this here. Musculo, it will be supplied to the muscles in arm, and then cutaneous, it will be supplied to the skin in the forearm. So musculocutaneous nerve, musculocutaneous nerve, guys. Okay, so just mention there, musculocutaneous nerve continues as lateral cutaneous nerve of forearm. You have to be like really careful with this one here, sir. Forearm, please underline that one. Musculocutaneous nerve continues as lateral cutaneous nerve of forearm, not the arm, guys. Forearm. I have seen some students getting confused over there. So it will be supplied to the muscles in arm, but whereas the skin in the forearm, guys. That's all done. That completes everything regarding the musculocutaneous nerve. Okay, so we have completed almost like everything about the musculocutaneous nerve here, guys. The root value, the origin, the supply to the muscles, motor supply, as well as sensory supply. Now, after completing here everything regarding this one, let me just discuss certain important MCQs which has been tested previously in the exams. So just write it like a note there, note number 1. Out of these three muscles, that is your coracobrachialis, biceps and brachialis, musculocutaneous nerve pierces one of the muscle. And remember, it is going to pierce the coracobrachialis muscle, guys. So try to make a concept like this in your mind, that musculocutaneous nerve is going to enter into the arm by piercing this coracobrachialis muscle. It will enter into the arm by piercing this coracobrachialis muscle, guys. That is the first point to note down. Musculocutaneous nerve pierces coracobrachialis muscle. Musculocutaneous nerve pierces coracobrachialis muscle, guys. Then next, number 2. One more thing which has been asked in your exams. Now, please look at this diagram here, guys. Just look at this diagram here. Now, in this diagram, you will get a very, very clear picture of, musculocutaneous nerve, how it is traveling, the entire course of that. First of all, in this diagram, you are able to appreciate here, this one will be the axillary artery here, guys. So, this will be the axillary artery. Fine. And I have already told you, axillary artery is the one, with respect to that, the nomenclature of the cords is given. I mean to say, the cord which is present lateral to that, lateral cord, medial to that, medial cord, and the one which is behind the axillary artery will be the posterior cord. Now, in this diagram, you are able to see that this one is present towards the lateral side. So, this is lateral cord here, and this is towards the medial side. So, this one is the medial cord here. And the posterior cord is not visible in this diagram here. It will be actually present behind. So, there is a lateral cord, there is a medial cord, and then there will be a posterior cord behind the axillary artery. Not visible in this diagram. Now, recall about the lateral cord, guys. Lateral cord is the one which will be giving rise to 3 branches, that is LML branches. M for musculocutaneous nerve. And now, in this diagram, look at this nerve here, guys. Just look at this nerve here. That is musculocutaneous nerve. And that is the one which is actually piercing this muscle. This muscle here will be the coracobrachialis muscle. This is coracobrachialis muscle here. And you can clearly appreciate there, musculocutaneous nerve is piercing the coracobrachialis, number 1. And after that, it is moving forward. Okay, then it is actually present between the brachialis and the biceps brachii muscle, overlapping this one here. Now, in this diagram, you are not able to see the biceps brachii muscle. It has been removed from here. So, just try to understand that the musculocutaneous nerve is going to continue between the brachialis and the biceps brachii muscle above. Now, after that, guys, if you see this last part here, you can see here, it's not stopping here. The musculocutaneous nerve is not stopping here, and it will further continue here, and that will further continue as the lateral cutaneous nerve of the forearm. Lateral cutaneous nerve of the forearm. But what I want to, teach you one more important thing here, which has been already tested in the exam, guys. Musculocutaneous nerve is piercing the coracobrachialis and supplying the entire coracobrachialis muscle completely. Done. Number 2, it is supplying the biceps brachii muscle completely. Done. Then it is supplying to brachialis muscle, but not completely, guys. Remember, musculocutaneous nerve will be supplying to only like one half, that to medial half. So it is just supplying to the medial part of the brachialis muscle. So the third one here, the third muscle, that is your brachialis muscle. Musculocutaneous nerve is not supplying to the entire brachialis muscle, guys. It is just supplying to the medial part of the brachialis muscle. Then what about the lateral part? Just think like this here, okay? So this is your humerus bone, and humerus bone, the shaft of the humerus, behind that you'll be able to find the spiral groove. I am sure that every medical student knows this one. Now in the spiral groove, the radial nerve will be passing from here. The radial nerve will be actually taking a turn and going on the other side, and here it will be supplying to the lateral half or the lateral part of the brachialis muscle, guys. Understanding? So radial nerve is the one which will be supplying to the lateral part of the brachialis muscle. So that is the second important point that you have to make a note here, guys. Yes. So please write down there, brachialis muscle. And brachialis muscle, you can divide that muscle into two parts. One will be the medial part and another one will be the lateral part of that. And remember, the medial part of the brachialis muscle will be supplied by musculocutaneous nerve, whereas the lateral part is actually supplied by the radial nerve, guys. Lateral part is supplied by radial nerve. Now, what is the importance here? What I'm trying to actually teach you here is, these type of muscles are actually known as the composite muscle, guys. Composite muscle. Or else it is also known as the hybrid muscle. Hybrid muscle. So what is the meaning of composite muscle or a hybrid muscle? It's a muscle which is actually supplied by two nerves. So you can clearly see here, brachialis muscle is actually supplied by two nerves, musculocutaneous nerve as well as the radial nerve, guys. So if you wish, you can just write down in short there, what is the meaning of composite muscle? Muscle supplied by two nerves. A muscle which has to be supplied by two nerves, and one of the best example of that is brachialis over there, guys. So brachialis muscle, the medial part of that is supplied by musculocutaneous and the lateral part of that is supplied by radial nerve, and that's the reason why it is one of the composite muscles in our body. That is the second point that you have to remember here. Now welcome to note number 3. So basically, after completing the topic of musculocutaneous nerve, I'm even trying to cover all the MCQs which has been tested in our previous exams and all, every concept related to musculocutaneous nerve, guys. Now just imagine that this one here will be the lower end of the humerus, and the lower end of the humerus will be having epicondyle. There will be a lateral epicondyle and then there will be a medial epicondyle. Lateral and medial epicondyle, guys. Now in some people, what is going to happen, the humerus bone will actually have a bony spur here, a bony spur there, and from here what is going to happen, there will be a ligament. From this bony part, there will be a ligament going and getting attached to the medial epicondyle. Not always present, okay? It is actually one of the abnormality. So what is the name of this ligament here, guys? This ligament is said to be the Struther's ligament. This is Struther's ligament. Now already this has been asked in the exam. What is this actually representing? Remember, Struther's ligament is actually representing the third head of coracobrachialis. Now Struther's ligament is actually representing the third head of coracobrachialis. Now sir, what is the meaning of this one? Remember, in the lower animals, what will happen is, the coracobrachialis muscle will be actually in the extended format, it will be having that third head also, but it's not in the human beings, it is actually in the lower animals. But in the human beings, during development, in some people, what is going to happen? It persists. If it persists in the form of ligament, and that ligament is nothing but Struther's ligament. Getting it? So normally it is not a feature of human beings. Remember, it is a feature of lower animals, but in some human beings, if it persists, then it will be in the form of a ligament. That ligament is known as Struther's ligament. So already it has been asked in the exam, Struther's ligament is representing what? It is actually the third head of coracobrachialis muscle. One thing done. Now if it is present, then is there any problem here? Of course. If this truthless ligament is present here, then what is going to happen? The median nerve can get compressed beneath that. And not only the median nerve, guys, along with that one, even the brachial artery. I hope you remember the median nerve and the brachial artery will be coming here as a content of cubital fossa. But because of the presence of this ligament, what is going to happen here, sir? The median nerve can be compressed beneath that one, leading to a syndrome, and that syndrome is said to be the Struther syndrome, guys. Is it okay? So this is the median nerve here, and this will be the brachial artery. Okay, and even this also has been tested in your exams, like what is the most common nerve that will be involved in Struther's syndrome, and that will be your median nerve. Median nerve can be compressed in the Struther syndrome, guys. So basically this is also related to like coracobrachialis muscle present in the anterior compartment. That is the reason why I just wanted to finish off this concept also here guys. Here only, guys. Okay, so better you just mention that last and final point here. What is the most common nerve to be involved in the Struther syndrome? That is your median nerve. Just mention there, guys. Most common nerve to be involved in Struther syndrome. Done. So by this, we have actually completed the entire musculocutaneous nerve, guys. Not only like the normal supply, the motor supply and sensory supply, we have even seen like the MCQs which has been previously asked. So I want all of you to remember these three notes here. Note number 1. Let us just summarize here. Note number 1, musculocutaneous nerve is going to pierce coracobrachialis muscle. Number 2, about the brachialis muscle being a composite muscle supplied by two nerves, musculocutaneous as well as radial nerve. And then number 3, remember about the Struther's ligament and the Struther syndrome, guys. So that's all about the musculocutaneous nerve. I hope you all remember still our planning. We are discussing all the major nerves. So we are totally having like 5 major nerves. Out of that, musculocutaneous nerve completed. Now let us go to the second one here. That's axillary nerve, guys. Axillary nerve. Now as I said you, in any nerve, first of all you write down the origin. And origin, my students are like expert. Axillary nerve will be originating from the posterior cord of brachial plexus. Now try to recall the mnemonic, guys. What is the mnemonic for the posterior cord? It's lunar. Lunar, and in this A here stands for the axillary nerve. Then what is the root value of the axillary nerve? It will be C5 and C6. Yes, we have seen that in the posterior cord, all the 5 branches, lunar branches, we have studied about the root values in detail. And remember, axillary nerve has got the root value of only C5 and C6. Now after origin, the next one will be the supply. It supplies to which muscles, guys? Axillary nerve will be supplying to only and only 2 muscles. Number 1, it will be deltoid muscle. Deltoid muscle, that beautiful muscle which is actually forming that rounded shape of the shoulder, guys, deltoid muscle. And another one will be the teres muscle. And in this, again I am telling you, please concentrate on the minor. It is teres minor muscle, not major muscle. I have seen many students getting confused over here. So by this, we are done with the axillary nerve. Wow. So if you follow my method here, guys, no tension at all, no stress at all, without mugging anything, we are already done. Okay. Now, that is a supply only to the muscles. Now, what about the sensory supply? Yes. Remember, axillary nerve will be actually supplying to the skin covering the deltoid. The skin covering deltoid. Now, in simple words, we can say that the axillary nerve is supplying to deltoid muscle as well as the skin covering deltoid. But guys, how to describe this anatomically? Look here. For example, I am sitting straight here. Now, this is my deltoid muscle and the skin covering the deltoid muscle is over here. That means it is towards the lateral side of the arm. So, that means axillary nerve is supplying to the skin on lateral side of the arm. But is it supplying to the complete lateral side of the arm? No. It is only supplying to the upper lateral side of the arm, sir. Fine. So, therefore, write down there, axillary nerve will be supplying to skin over upper lateral side of arm. Upper lateral side of the arm. And if you are interested there, guys, you might be wondering, if upper lateral side is supplied by axillary nerve, what about the lower then? The lower lateral surface will be supplied by the radial nerve. I just told you the radial nerve will be taking a turn here. So radial nerve will be taking care of the lower lateral side of the arm. So coming back to our topic here, axillary nerve will be supplying to upper lateral side of the arm. Now try to understand the applied aspect here. Suppose if the axillary nerve gets injured, if there is injury to axillary nerve, then the person will not be able to sense anything from the upper lateral side of the arm. Okay, the person will not be able to sense anything from the upper lateral side of the arm, guys. There will be loss of sensation, and that is actually referred to as the regimental badge sign. Regimental badge sign. I hope you have seen in that army about the regimental badge and all. So they'll be wearing the badges over here, So therefore, the doctors have kept the name as regimental badge sign. So basically, what is a nerve involved in the regimental badge sign? It is your axillary nerve. If axillary nerve is gone, there will be a loss of sensation in the upper lateral side of the arm. So better you do one thing here. Just write down there as applied aspect. I'm writing in short as A, applied aspect. In that, regimental badge sign. Now, what is this regimental badge sign, guys? Regimental badge sign is loss of sensation from upper lateral side of arm. Upper lateral side of the arm, guys. Fine. So what is regimental badge sign? It is nothing but loss of sensation, sensory loss from the upper lateral side of the arm. And of course, what is the nerve involved here? It's because of injury to the axillary nerve, guys. And this completes your axillary nerve also. So out of the 5 major nerves, we have completed 2 of them, that is musculocutaneous and axillary. And now comes the most important ones, that is your ulnar and the median and the radial. All of them will be discussing together. Thank you.